I'm here in the middle just to talk to you about one of the programs that the Georgia Restaurant Association and the National Restaurant Association have put together with United Healthcare to help you find a solution around how to deal with the problem. And they're, policy and how to deal from the operator's perspective. And this is one approach for a solution. The National Restaurant Association, we actually have a joint venture between United and the association, so it's a little bit different than a partnership that you may hear about in other situations, in that this is a 50-50 joint venture that we've put together. And it came together pre-reform, actually, and that was because the CEO of the National Association, Dawn Sweeney, she had worked with the CEO of United, Steve Hemsley, at a previous job, and they had worked on a program that worked really well with another association. And so when they came together, they looked at this and they said, gee, there's a great opportunity here for both of us, because, when you look at the long-term trends with the industry, there is, in the restaurant industry, there is a need to, engage your workforce and to have them there long-term to deal with those demographic trends. And one of the things that can help out with that is benefits, and that's what got the conversation started. But then, obviously reform changed that and certainly put a lot more urgency around people in the industry finding coverage. The discussions that went through it also came around that this is just a very natural fit between our two organizations, and that is because the National Restaurant Association as a whole, it's the second largest business association. The people in the industry here, the people in food service, it's the third largest occupation in the country as well. So very big, and United is the largest health insurance carrier in the country, and really the only one that has a really viable national offering to help out with the association in the industry. So what that program is something that you, as members, that you can access, and there are different components to it. One of them is that, certainly kind of starting there up in the right there with the pricing, is that for those of you who are considered large employers under those calculations, you'll be, as an association member, eligible for a 3% discount on the medical rates, and that is actually pretty substantial. It can work out anywhere from $125 or more per employee per year. So it's a pretty substantial savings there. We also have discounts on the on specialty lines, which are dental, vision, things of that, which are 5% for members as well. And we have, when you talk to your broker, they may mention another program we have called Package Savings, which is available to everybody. The association's 5% discount is on top of that. So you're actually getting, the math is a little different, but it works out to about a 10% discount there as well. So you're getting some discounts around that with by being a member of the association. One of the things also that we have in terms of the product side that's good for this is that all of the products we offer out there are eligible for this program here with this. So there are sometimes programs where they say, hey, you can only buy a subset of these certain things to be part of this, and that's not the case. It's all of our things, and that's really good for when you're working with your broker. That doesn't mean you have to switch necessarily. So if you're very comfortable with the $1,000 deductible plan that you're offering today, you can still offer that through this program tomorrow. It's not going to force you into some other type of benefit change that's going to be on top of everything else you have to do with reform. So it makes that, that transition a little easier with that. We also have something that we have called the Optum Restaurant Healthcare Discount Card, which is really designed, this was pre-reform that this was built, and it was really designed for people who you're not offering coverage to as a way to help them get access to care. So it's not insurance, so it doesn't help you with the mandates or any of those things, but for those people who don't have coverage, it's a really good way for them to get access, because what it does is provides them the discounts that they would get through a health insurance carrier. And so because of our size, we're able to negotiate meaningful discounts. And so this helps them be able to go and see the doctor and get a discount and not have to pay that kind of billed rate that you read about with the $8 aspirins and things like that. So it has that. It also covers drug benefits as well, and they can call in and talk to people for employee assistance programs. And that's only $5 a month, so it's very inexpensive for something if you want to go down the road of offering something to your employees who are not covered for benefits or not eligible. Also on here, the distribution, we have what we call a wide distribution model, which means that if your broker works with United today, they can be part of this. There are some times where they can only be, only a subset of brokers are available to work through a program, and we here have all of the brokers who are signed up with United through that. So, you know, really what we would ask you for on this is just to go talk to your broker, make sure you get that quote. I think with the discounts with the program here, you're going to see that you've got a good offering, and it's a way that you can help to, you know, get some mitigate some of the cost increases that you're going to see through reform. The one of the other things around packaging here, well, just real quickly about United Healthcare in Georgia. So I mentioned before we're the largest national carrier. So, but we have a very strong local presence here. So we insure over 1.5 million people here in the state of Georgia. So you surely know somebody who is covered by United Healthcare. We also have a large number of employees here with 6 offices and over 2,000 employees in the state. And so, you know, certainly substantial presence, a very large network, broad network here, and a full range of products that I kind of touched on that earlier. So the Georgia Association, they've got a very good partner here that they found for you. One of the things also that we've worked on with the National Restaurant Association, this is another offering that is exclusive to members, and so this is not available at all to people who are not members of the association. And this has to deal with the notification requirement. And so that is, you know, at least as of today, it's still on for October 1st, and that applies to all employers. So it's not a 50-plus thing. It's, you've got to be, if you hire anybody, then you fall under this notification requirement. And so there's not a penalty associated with the requirement for October 1st, and so some people kind of shut down at that point. But I think especially with the fact that the mandate's not in place, the employer mandate has been delayed. And you still have the individual mandate in place. It actually increases some of the risk that actually employers are going to bear here. And the concern here from the association's perspective is that what's going to happen next year in particular and going forward is that there are going to be employees who go out who choose not to get coverage, and then they go and they get injured off the job, you know, doing whatever it is they do. They'll go to the hospital, and then the hospital can then say, okay, what's your insurance coverage? I don't have any. Well, didn't your employer tell you that you could go to the exchange and sign up for subsidized or practically free coverage? No, they didn't tell me that. Now, you may have put a sign up in the lunchroom kind of thing, and that was there. But the fact that you can't document that means that the hospital can come back to the employer and say you need to pay those claims because you didn't notify the employee of their ability to get that. So it works very similar to a COBRA notification for those of you who may be familiar with that. And there's well-established case law around COBRA notification where it holds that the employer is responsible if you cannot document that the employee was notified that they knew about this coverage. So that is really what the risk is around that. And so the more employees who are out there who have chosen to go without coverage, the higher that risk is. And you have to tell every employee this. So it's for October 1st, but every new employee that you bring on after that also has to be notified. And so I know certainly the industry has high turnover here, and so those people who have more people going through, maybe only working for a couple months, they still have to be notified. So that's kind of the case for why you want to address that. The association has come up with a portal to help you simplify that. And so I certainly encourage you to go out to the website here on this page, which is healthcareadvice.com. You can sign up for it. This is free to members. If you're not a member, you cannot get it. It's not available for sale. So I think the association has really done a great job in coming up with this. There is an option here where you can also customize the portal with your company brand. So if you want to put that out there, there is a charge for that. I believe it's $300 is what they're charging for that on an annual basis. And then if you are with United Healthcare, that customization is actually free with that. So the Department of Labor templates and these other things that will be there to, so you can document that notification. That's in there, so it will simplify it. And then the association stores that kind of electronic signature from the employee, so that if they come back and they say, I didn't know about this, now I have a claim, you can go and the association can pull that up and they can say, yes, this person did go on the portal, they received their education notification, they knew about the exchanges, and then that would mitigate, then you wouldn't be liable for that. So the thing that's neat about this portal too, also when you think about this, is that you are sending all of your employees out to one place for their healthcare benefits, or their healthcare education, I should say. So they go on there, they find out whether or not you as an employer are offering anything, and then they know about, also they learn about the exchanges and all that. So when they come out of doing that notification, those employees, you can help them go to a place where they can actually get coverage depending upon what their status is. So if you've got the people that you're offering, your managers or whoever that is that you're offering and are eligible, you can link them over to United to an electronic enrollment program, or to a private exchange like Andrea was mentioning if the broker is offering that. And so they can go on and do an electronic enrollment there and really simplify that process for you. But that's, let's face it, that's going to be 30% of your employees probably even after reform. So for the other 70% of them, they can go over to this other web entity that the association is signing up right now. And what they can do is that entity will then talk to your employees who are not eligible for coverage. It will talk to them about whether or not they're eligible for Medicaid and direct them to where to sign up. They will act as a navigator as well if they are eligible for a subsidy on the exchange and want to sign up there. And if they make too much money, they can sell them an individual policy. And so, it gives those employees who you're not offering coverage to a very, easy way to go and find coverage for themselves. The other piece that's good about this is that they're fulfilling that navigator role here. And so there are a lot of entities. You're going to start seeing in a couple weeks advertising around the exchanges coming out as they do a big push to get people to sign up. There's going to be a lot of groups that are acting as navigators. Some of them have other agendas, and that's one of the reasons they're coming in to this navigator role, is they look at being able to use the benefits discussion as a way to further a different agenda with them. And so, there's that risk. You also have people out there who, frankly, are not going to be very well trained and not really going to know what they're talking about. And what you'll have here is that that the National Restaurant Association has worked with an entity who knows what they're talking about, and they don't have another agenda that when they're talking to your employees. And so, around this healthcare piece. So that also is a really great thing around this. The one other thing I also want to mention about this, that I think for those of you who have a large number of multi-unit locations, this is really going to also help out your store manager, because what's going to happen on, your employees are going to come to them and they're going to be, hey, where's my free health care? And you don't want your manager, who really, is not an HR expert, sitting there saying, okay, well, wait, John, okay, he's not, okay, how many hours do I have him scheduled for? Did I go through the look back period? Okay, am I offering it to him or not? So therefore, I tell him to go talk to this person to sign up for employee benefits, or do I need to tell him to go over here to the insurance exchanges? Or maybe if he's just started, he might even be eligible for Medicaid. So what do I tell him? And so he's got, your store manager's thinking this through. You really don't want that. You want him focused, or her focused on running the restaurant. And so they can just say, hey, look, go to this portal. They'll talk to you about what the options the company has available to you and what else you have available through the insurance exchanges, and then you can make your decision. Let me run the place. So that's what I think is also a really great value out of this portal here that you can do. And once again, that is something that is only available to members of the association. So that was really the extent of what I had here today. And so I was just going to hand it over to Don. He will come at this from the operator's perspective. And thanks, Don.
Thanks, Clinton.